is not period again. We have 31 days in a month. Some have 28 days. After 28 days, their period comes in. Some have 30 days, their period comes in. Some have 31 days, their period comes in. Some don't even have that until after some months. That is an irregular menstruation. It is not a regular menstruation. Every woman, their normal cycle is 28, 30, or 31 days. That's what I'm trying to say. Now, in premenopause, some changes start occurring, but they are not noticeable changes in premenopause. Now, every woman has hormone. Now, what is hormone? They are usually made in the ovaries in female and testes in male. That's the hormones in women. The two female sex hormones are the estrogen. That's a steroid hormone associated with the female reproductive organs and is responsible for, you don't understand. I should come again. Please, can we please bring down our voices so that we can understand what we are saying? So what do we do? Should I pause? Okay. Okay. If you are eating, please still bring down your voices. You are just using your mouth to eat. You shouldn't use your mouth to talk. Our mommies and our children, so that we can understand what we are saying here. One house, please. Can we continue, please? Now, I said, what is hormone in female? Hormone, they are usually made in the ovaries in female and testes in male. There are two female sex hormones. They are the estrogen. What is estrogen in female? It's a steroid hormone associated with the female reproductive system and is responsible for developing female characteristics. Let me come again. What is estrogen? E-S-T-R-O-G-E-N in female. Is a steroid hormone associated with the female reproductive organs and is responsible for developing female characteristics. Then we have progesterone in female. What is progesterone? It's referred to the pregnancy hormone, and most of its function relates to maintaining pregnant. Can you understand what I'm saying? Let me come again. Progesterone. Female have estrogen and progesterone in their system, in their organ. Now we have talked about the first one, estrogen. Now we are talking about the progesterone in female. It is referred to the pregnancy hormone, and most of its functions relate to maintaining pregnancy, promoting gestation. That is, when a woman is pregnant, it promotes the growing of the baby inside a woman. And it also plays a role of regulating menstruation in women. It plays a role in regulating menstruation in women. How do you know if you are in your premenopausal age or stage? You can know that if you have a persistent change of 7 days or more in the length of your period. 7 days or more in the length of your period. How long does premenopause last in a woman? When we talk of premenopause, it lasts 8 to 10 years before it results to menopause. Meaning, from that 8 to 10 years, you will still see your period, but it might not be regular. And some might be regular. But you might have some signs, like some people have 3 days menstruation. It might get to a stage, instead of 3 days, you might have it 1 day. Sometimes it might be clotted. The period will not flow the normal way it's supposed to flow. Some have their period 7 days. Some have 4 days. Some have 3 days. Some have 2 days. Now, some that have 4 days, it might reduce. The period start becoming irregular. It doesn't flow the normal way it's used to flow. That's when you know you are entering your premenopause stage. Now, the ovaries start producing less estrogen in woman at that period of your premenopause. I have explained what estrogen means and progesterone. I have explained what it both means. So I won't be going back to it so that we can round up and go. The body starts to prepare to stop releasing eggs at that stage of your premenopause. It reduces the eggs it produces every month. When a woman does a period, the egg that is supposed to turn to a pregnancy breaks down and becomes your period every month. The moment a woman gets pregnant, you don't see your period again. Some see for a period of time before it stops finally. So it depends on the body. The first sign differs from every woman and tend to start in their 40s. Some see before 40. Some see early 40. Some see in their 50s. Some see 51. But medically, when we talk of menopause in women, it starts from the age of 50, 51. Anything less than that is called premenopause. Some even see their own. They start their own at 30s. The funniest thing is, both menopause and premenopause, they are all natural in women. But when a woman sees earlier than the normal time, there are drugs they prescribe for them to bring back the period to flow the normal way it's supposed to flow. But anything above 50, you let it go because it is a normal age for menopause, except you still want to give birth to, like me. Hallelujah. Now, causes of early premenopause. Early premenopause happen when the ovaries stop making hormones. That's your body chemical messenger that travels in your body stream to tissues or organs. The period stops at a younger age than usual. This can happen naturally or for some medical reason, and such as when a woman has an issue that they have to remove her ovaries. That is one of the reasons. But aside that, it is a natural thing for a woman to come into menopause. How do you know as a woman that you have started premenopause? When your menstruation cycle is lengthy or shortened. That is, you see your period maybe 7 days and it comes longer than the 7 days. Or you see your period 7 days, it comes shorter. One of the signs you start seeing that you are entering premenopause. Please be careful with that bottle. Wala golong pala is water. And some people, one of the signs they will know they are entering premenopause is that they don't ovulate again. Though they see their period, but they don't ovulate. There's no way you can release egg for pregnancy to occur. Now, what are the symptoms of premenopause. We have irregular or skipping periods. Meaning, if you have your period, maybe you have it January. The period might not come again, maybe until April. The period might not come again, maybe until September. You know, you start skipping months. It doesn't come regularly like the normal, every month you see the period. Those are signs of premenopause. Or your periods. Normal, when you have your period, maybe in those 3 days, normal when a woman has a period, the first day, don't touch, I've not started my own teaching, no. Here. The first day, when a woman is having period, the second day is always heavier than the first day. So some women, when you start having your premenopause, you might see it might be heavier than the usual or even lighter than the usual way you have your period. Now, you start having changes in your taste. You start having joint pain, mood swing. That's your premenopause signs. You're having mood swing. You have breast soreness. You have irritability. You get irritated easily. You get depressed. You have night sweat. At night, everybody's feeling cold. You are sweating. You have headache, constant headache. Either the migraine and the full head. Those are symptoms of premenopause. Yeah, you have decreasing fertility. You have sleep disturbance. That's to sleep at night is always an issue, even during the day. You have memory lapses. You don't remember things like before again. You start gaining weight unnecessarily. You start craving for some foods that you don't before. Or you start having increased appetites. You have allergies to so many things. Irregular heartbeats. Some have body odor. Then decrease libido. I have to watch some words because we have children here. Now, how to control premenopause symptoms? You eat less of salty food. You eat less of fatty food. Then you eat less of sugary food. Get plenty of food. Of sleep. Kilerima, I should come back to symptoms. Okay, I should come back to symptoms. Symptoms of premenopause. We have irregular or skipping periods. We have periods that are heavier or lighter than usual. We have changes in taste, joint pain, that's arthritis. We have mood swings. We have breast soreness, irritability and depression, night sweats, headaches, especially migraines, constantly, decreasing fertility, having issues to sleep at night, memory lapses, excessive weight gain, food craving, allergies, irregular heartbeats. Some have body odor. And we have some that have decreased libido. And we talked about, I've not spoken menopause, Seth, so don't do hand like this. No, I can't say that, sorry. How to control premenopause symptoms. You have to eat less of salty food, fatty food, sugary food. Try and get plenty of sleep. Relax when you have the time to relax. Exercise yourself often. Take your medications. Do more of breathing exercises. It helps to relieve stress. Some will ask, how do I prevent premenopause? it cannot be prevented. It is natural. So, if you have other lifestyles, there are some things you want to ask more on medications or what to use. When you see your menopause earlier than the usual dates, please, you can ask your health provider. I'm not here to give anybody drug prescription. I'm just here to talk about what you can feel when you have premenopause and all that. But if it comes to drugs and all that, please, I am not here to prescribe any drug for anybody. Now, I'm trying to hasten up. Let's come to menopause. What exactly is menopause? Menopause is a time that marks the end of a woman's menstruation period, menstruation cycle. How do you diagnose menstruation in a woman? Or how can a woman say, okay, I think they are menopausal? That is when you don't see your period 12 months. That is in a year. You do not even see a drop of blood. Then at that stage, the woman is menopausal. That is what menopause is. Now you don't see your period for a lengthy period of a year. That is the menopause. It can happen in any age. But we talk of 40, 45, 50, 51, upward. But the average age for a woman to go into menopause is 51. 51. 50 is okay, but 51 medically is 51. Now, it is a natural part of aging and marks the end of one's reproductive age. At that period, you cannot give birth again. You cannot get pregnant again. Because a woman that doesn't see her period or is not ovulating cannot get pregnant, except it takes the grace of God. Now, at this stage, your ovaries have stopped producing eggs. What are the signs of menopause? No period at all. That's absence of menstruation. Some start having signs of lost hair. Some even have excessive hair. That's hair in the scalp. Some have excessive weight gain. Some has insomnia. That's unable to sleep. They are all similar to premenopause symptoms too. Some have dry skin, excessive dry skin. Then, in a woman that has menopause, please, you have to be extremely careful of where you wee, the place you wee, where you urinate, because you are the skin attracts infection easily. Why? Because you don't pass out the waste in you again. You take them in now. So you have to be very careful with where you wee, where you urinate. It's very important. Because it makes a woman have urinary tract infection. You are prone to infection. Some have dry mouth and eyes, painful or stiff neck, migraines. That's the most common headache symptoms of a menopausal person. Migraines are always constant. Natural menopause occurs not due to surgery or certain health conditions. It is a natural process due to aging. The reproductive cycle will slow down and eventually stop. The reproductive cycle begins at puberty. That's the stage, the period during which adolescents reach sexual maturity and becomes capable of reproduction. That is the puberty stage. Most females start their puberty when they are 8 to 13. Some start seeing their period at that age. Hormones from the brain triggers the start of pre-puberty and continues to function thereafter. When approaching menopause, the hormone estrogen produced by the ovary will decrease. When this happens, the menstrual cycle will change. Menstruation can be irregular until it finally stops. Now, we talked about premenopause. We said it's irregular period. Now, you have your irregular period, maybe like 8 to 10 months, 10 years. That's giving you the sign that you are going to menopause. Now, it gets to a stage when you start seeing irregular periods, and you don't treat it when you are supposed to treat it because you have not gotten to the age of menopause. By the time you know, all of a sudden, the period stops. And when the period stops, bringing it back will be very, very, very difficult. And when a woman enters menopause earlier than usual, we say it's premature menopause. There are 3 phases that occurs before menopause happens. We have the first one, premenopause. Transition. It occurs 8 to 10 years before your menopause eventually comes in. That one starts when a woman is 40 years of age. Fast. Then we have the second one, perimenopause. That one will last 2 years before the menopause, before the menopause itself eventually, I'm trying to round up. Before the menopause itself eventually comes up. That one, it happens when the ovaries completely stop releasing eggs in the last 1 to 2 years. At that stage, you don't even ovulate again. You just see your period, but you are not ovulating. That's the estrogen level has reduced. This time, when women especially experience menopause symptoms, some women still have the period, which means they still have the potential to get pregnant. Meaning, a woman that still sees her period can still get pregnant. Except a woman that sees her period and is not ovulating. If you are not ovulating, you cannot get pregnant. So, a woman that is ovulating or still seeing her period, even if it's irregular, as long as you are still seeing your period and you are still ovulating, you can still get pregnant. Okay. Okay. Sorry, they said I should take question and answer. Time. Sorry, we have to. So, if you are menstruating and you are not ovulating, you can't get pregnant. If your period eventually stops, you are now in your menopause sign. That's between I've not finished, don't raise your hand. That's between now to 10 years. After, once the period stops, 12 months after, and you are not seeing your period within that 12 months, then you are in your menopause stage. God bless you. Question and answer. Mommy. We have different symptoms of ovulate when you know you are ovulating. As a woman, some have, let me say symptoms when a woman is ovulating. Ovulation comes in 16 days before your next menstruation. It works for some, it doesn't work for some. So your calculation depends. Now, we have symptoms for women that are ovulating. Some start having cramps beneath their tummy. Serious one that you start feeling it as if, sometimes when a woman is pregnant, there's a dragging in that place. But it's similar to it, but that is not the way it comes. But you feel some cramps here. Now, as a woman, when you clean up, we have the, praise the Lord. Next question. These children are here. Okay. 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 So, now let's do the calculation for ovulation. A woman sees her period 12th of a month. We have your 16 days before the next period is your ovulation. Now, the first 1, 2, 3 is very active. At that period, a woman can get pregnant. Now, I said some women menstruate and do not ovulate. It's because the level of the estrogen has reduced. So you have to go and check in the hospital. You have to check your fertility level. Because you might not even know you are not ovulating. But personally for me, as a woman, what I tell a woman is when you want to know you are ovulating, even that cramps we are talking about, it's not everybody that notices it. You understand? Now, we have different vagina mucus. What we used to know if a woman is ovulating is there is one that is very slippery. Very slippery. It's like egg, the white egg, but very slippery. At that period, it just comes in within 3 days. After that 3 days, it comes to a creamy color. So you see that period at which it's very slippery. That's the period a woman is ovulating. Anything that comes in at that period has come to stay. Bam. Next question. I've answered it. Yes, please. That's not ovulation. That's not ovulation. The ovulation is the stretchy one. It's like okra. It's very stretchy. That aloe vera color. That's how it is. Yes, please. Yep. The reason is this. We all have different body. Our system are very different. Now, some have periods that are not even regular. And you don't know your periods are not regular. We have 28 days lengthy. We have 30 days, we have 31. If I ask how many, all of us now, how many days interval do you see your period? I won't tell me as a person, I won't tell a patient, calculate with that. The reason is that if I tell you to calculate with that, so many people will fail it. Because not everybody can even calculate their period. If I call you now, how many days interval do you see it? They can't tell me. Because not everybody has that time to be checking. You understand? That's why when you clean, some will tell you they can't insert their finger. I do it to check when I'm ovulating. I don't do the calculation because it doesn't work for me. But medically, I'm talking of medically, they tell you 16 days before your next period. Within that 16 days, we have the 3 most fertile days, which give you. Now, you might have intercourse within that 3 days, and you might not get pregnant. Or when you're ready at 1, ready at 1, even when you least expected. Some don't ovulate and they get pregnant. That is God's work. But we are talking of the medical aspects now. So it's not everybody that is menstruating that is ovulating. And it's not everybody that is ovulating that is menstruating. So there are some drugs they use in boosting ovulation for women that are looking for fruit of the womb. Because some ovulate, you don't. Some menstruate, you don't ovulate. And it's not everybody that knows that. A woman believes, okay, I've done my menstruation. The next thing is ovulation. And you are not ovulating, and you don't know you are not ovulating. So there are drugs we prescribe for them. You use at that period. You use it within, even when you are having your period. You use that drug within 3 to 6 months. It helps boost the ovulation. Then you can even calculate your menstruation and your ovulation, because it will make sure it stabilizes the whole thing. The hormone that is causing the whatever not to ovulate, it brings it back to normal. You know, when a woman gets to a certain age, you can't compare your age when you are 40 to when you are 28. It's not possible. At 28, you can easily get pregnant if you want. That's if God. But at 40, it takes the grace of God, because your body system is not like when you were 10 years. So that's one issue with we women. The more we get older, the more everything reduces in our system. Any other question? Even men. And why I'm not saying men is because it's women's program. That. But truly, as it affects women, it's the same way it does with men. So, everybody. Some men, when it gets to a certain age, the sperm is not so active like it used to. It becomes weak, it reduces. So there's drugs too they use in boosting the sperm for men that wants babies. But once you don't want it, they just let it go. If you are not ready to have a baby. When it gets to a certain age. When you get to a certain age, it is. But anything below 50 is dangerous. But above that, it has no meaning. Is that all? Okay, ma'am. Mommy wants to give us a baby next month. I receive it.
In a situation whereby a lady is being told that the person is not producing estrogen, what can such a person do? Because you said without estrogen, the person cannot ovulate.
Like I said earlier, there are drugs for all that. There are drugs, no, not me. They prescribe to help boost the estrogen and progesterone. So that when a woman is ready to get pregnant, she ovulates, the eggs, the eggs are being released. But when the woman is treated, when they are treating the woman, they will treat the man too. Because it's not just about women. They will have to treat the both of them. So that the sperm that comes out will be very active. And anyone that goes to the egg that is active will be able to produce the child. So there are drugs for it. Enough drugs to help boost the progesterone and estrogen for women and for men. Is that all? Don't be scared though. Okay, ma. Mommy, let's be honest with ourselves. There's no food. You know why I said there's no food? 99% of us, tell me in a day if you don't eat rice, raise up your hand. Tell me in a day if you don't eat rice in your house. In a day. You are eating rice, you are not putting the balanced diet that you are supposed to put inside. Please, what are we talking about? Let's not go to that place, I beg, because we are all guilty of it. Without no vegetable, nothing. When I go out, I see pepper, I pound everything, put together, eat. My own is for food to be in the tummy. That's what most of us do now. So let's be honest. If you are talking about food, God bless you.